I'm standing in one of the wards at the Cape Town International Convention Centre that has been turned into a field hospital. Now this of course will be the largest of the 4 field hospitals that are in the making, and at the last count this hospital should be ready by the end of this week. It will draw in patients from across the Cape Metro where there's an overflow at other hospitals, and they will be treated here. Now I'm just going to step out of shot for a moment so Clinton Surf can show you what it looks like. It's fully fledged wards. Anyone who's ever been to the Cape Town International Convention Centre knows that these major halls are usually used for conferences. There's usually stalls set up, there's usually business happening here, and it's quite an ominous feeling to be standing here and looking at all these beds. It's an 850 bed facility, and at the last count the province needed around 1,600 extra beds for when the peak of the pandemic will be reached. Now they're using different models to determine when that will happen. You must also remember there's nothing to measure this against. So scientists are working overtime to get some sort of prediction in place to help provinces like the Western Cape prepare for what could be the worst case scenario. Now, the latest information from the various models that they're working with is that the peak of the infections will be towards the end of June, beginning of July, and there's an estimation that as many as 9,300 people could die from COVID-19. Currently, there are just over 20,000 infections, but half of those infections the people have already recovered. So active cases as of yesterday afternoon at 1 o'clock was 10,004 people, and there's just over 480 people that have passed away. Now, of course, today the Minister of Health, Zweli Mkhize, is visiting Cape Town to see the readiness of the province, as it currently still has the highest infection rate in the country. He's visiting, and he will be taken to various hotspot areas, including Khayelitsha, and then tomorrow to the municipality of Witzenberg, which includes the towns of Ceres and Tulbagh, which is one of the biggest hotspots outside of the Cape Metro. And he's here to inspect the readiness of the province to deal with that possible peak or that possible climb in numbers in the coming weeks and in the coming months. He's doing a round robin of all the hospitals. He only spoke briefly to us, saying this is not just a provincial issue, it's a national one, and again reiterating that everybody needs to work together to fight COVID-19 and to ensure that as few as possible people, first of all, get infected, and then of course that as few as possible people die.